Hello, everybody. Welcome to the webinar. Dr. Weiner is here. Dr. Whitty Adams is here. Our other panelists will be joining us soon. Hi, friends.
Recording in progress.
Oh, my goodness. Welcome, everybody. Welcome, welcome, welcome. We're so excited that you have joined us. We're going to give just maybe one more minute before we dive into our webinar today on weight loss medications and bariatric surgery. We have an amazing panel lined up for you. You can see them on your screen, we hope. This is a new format for us, so I apologize if things seem a little bit wonky. We're getting used to it ourselves on our end. But when we learn and grow together, really great things happen. Oh, I can see the chat too. Hello, hello. Awesome. Welcome. Well, friends, before we dive in, we would love to gather just some feedback from you. So there we go. We have a little bit of a welcome survey. I'm going to go ahead and launch it for you now. Please just take a few moments and answer those 4 questions, if you wouldn't mind. We just want to know where you're at along your bariatric journey or your weight loss journey. We'd love to know if you've been to a webinar before, what you're kind of here for. And I know that there's a lot of options there. Just go ahead and pick the one that is most aligned to why you decided to join us tonight. I can see somebody has their hand raised. Oh, it disappeared. Thank you.
They're saying the questionnaire went away. Oh, there we go.
Boom. Oh, I see some very familiar names, but I see some new names. Welcome, everybody. Ooh, I love seeing these poll results come in. We'll leave all our poll questions up for maybe just another minute or two. And as participants tonight, you guys, you should be able to directly message any one of our panelists. There's also a Q&A box down there. If you drop your question in that Q&A box, it'll get broadcast to everybody that is watching this live. And then one of our panelists will go in there and we can answer them for you kind of as we're moving through our webinar. I'll leave it open for just maybe 30 more seconds. So if you haven't answered it, please go ahead and do so. Hello, welcome, friends. Oh, I can see the chat. It went away. Okay, thanks. Awesome. Yep. Before
Okay.
Yep, go for it, Dr. Weiner.
Do you want me to start with the disclaimer? I'm just going to read a little medical disclaimer while everybody's filling this out just to get this out of the way. I'll read it really fast, just like on the drug commercials. The information in this webinar is for informational purposes only. No this webinar is intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment before undertaking a new healthcare regimen. Never disregard professional medical advice or delay in seeking it because of something you have read on this webinar. And I think the final thing is that nothing that is said here by any of the providers on the panel represents a doctor-patient or provider-patient relationship. And in order to establish that, it would have to be in a formal medical setting. Okay, done.
Bingo. We got the hardest part out of the way.
Yes.
Oh, We are here tonight, friends, to connect with you, to learn with you, and to grow with you. We want this webinar to be very interactive. We want to make sure that you're getting your questions answered. And if we don't have time to answer all of them, we will be recording the chat and the questions, and we're going to be sending out an FAQ document after this event so that everyone's question really has that space to get answered. But we're thrilled that you have decided to join us tonight as we learn about bariatric surgery and about weight loss medications. So I've ended that welcome survey and I've just posted the results so we can all see it. So we all kind of know what people are really hoping to get out of our time tonight. So it looks like, right, we are very much hoping to understand more about these medications and about weight loss surgery. Most of us here tonight are post-op bariatric patients. That's phenomenal. That kind of helps us kind of steer our conversation. If this is the first time we've had some webinar attendees, awesome, welcome. At BariNation, we do a monthly event. We call it a virtual bariatric meetup, and that's hosted in just kind of a regular Zoom session. So it's a little bit more interactive. The reason we chose to go with the webinar format is we know that this is a very hot topic in our community, and we wanted to just kind of be a little bit more protective of our space. So it's the interaction will be a little bit different if you're used to joining us at our usual BariNation VBM. Some of you are familiar with BariNation, you're not familiar with Dr. Weiner, or you're familiar with both of us. Welcome. We're so excited that you're going to get to know all of us a little bit more today. And it looks like most of us are hoping to leave here tonight with more information about medication as a primary or adjunct treatment for obesity. And really just people want to learn more about medications and finding that sense of community. So awesome. Welcome, friends. I'm going to share my screen and we are just going to dive right in. All right. Maybe give me a thumbs up. Can everybody see my screen? Awesome. Thank you so much. And I do have the chat pulled up here. I can see the Q&As are rolling in. Wonderful. Well, welcome again to our first of what we are hoping will be 3 webinars that we're calling the Metabolic Wellness Webinar Series. And tonight we are diving into weight loss medications and bariatric surgery. We believe that when patients and experts combine to create support, really amazing things happen. So really, we're here tonight to learn more about the chronic disease of obesity that I'm assuming almost all of us are living with. And we're looking for solutions, for treatment solutions, not necessarily for a cure, but just to understand how we can live our lives with this disease. So the goal of this webinar series is really to provide practical and timely talks that are focused on these hot button issues within the bariatric community and just within kind of the greater obesity community. So again, thank you for joining us tonight. We would not be able to do this without the very kind support of our sponsors. So A Pound of Cure Weight Loss is sponsoring this evening, BariNation is sponsoring, and ProCare Health. But I'd just like to turn the mic over to Dr. Weiner to thank him for sponsoring this event with us and to share a little bit more about your Pound of Cure Weight Loss program.
So thank you, April. This is a fantastic webinar that we put together. I'm really excited and I appreciate the opportunity to be a part of it. I'm a bariatric surgeon in Tucson, and pretty much everything that I do stems out of my practice. And we have the Pound of Cure Weight Loss is the name of my practice, and then we really consider ourselves a multidisciplinary obesity treatment center as opposed to a bariatric surgery practice. And so we offer telemedicine through California, New York, Michigan, Arizona, and Florida. And we provide both surgical and non-surgical weight loss in those areas. We have a nutrition program, and we're really working closely with BariNation because we have, I think, a little more of the clinical side of things, and BariNation really has a community, and it's two together that's really the most powerful component. So we have I have a fantastic dietitian named Zoe, and we have a lot of support groups, really, several every day that people can join and participate in. It's really kind of initially targeted at my patients, but we have people from all over the country and actually even the world who join us. So again, thank you. Really happy to be here. And, I think this is going to be a great conversation.
Absolutely. We have so enjoyed our partnership with you. We know that we also have a membership community, and we've been able to really share supports where our communities kind of need to fill those holes. And it's been a wonderful, wonderful experience. I'd like to turn the floor over to Jason to just quickly tell the world about BariNation.
Hello, everybody. My name is Jason. I'm one of the co-founders of BariNation. We started as a humble podcast that April and I created back in 2020. I was 2 weeks post-op when we started talking about that. So really trying to find my way and what was going on. But we've kind of developed that into a community on Instagram, as well as now we've started a membership community where we host hundreds of events per month where you can get help from bariatric therapists, regular therapists. We have nutrition classes taught by the leading dietitians in our community. We have cohorts led by other patients who are further along that kind of teach people. We also have movement classes that are done by registered. We've got registered yoga teachers in there. We've got just movement instructors that are registered that come in and teach classes. Just really kind of an all-around help for those in any stage. Honestly, we have people from pre-op all the way to 20 years post-op. Some of the people that participate in what we've got going on. So at any point in your journey that you may find yourself in, there's support there for you.
Thank you, my friend. We like to say, no matter your age, no matter your stage, you belong in BariNation. And we are working hard to live that mission. Last but certainly not least, Miss Natalie, would you like to tell the world about ProCare Health?
Absolutely. ProCare, we love ProCare. We use them. April, Jason, and I use their vitamins, their supplements daily. They have wonderful one-a-day vitamins. By themselves, they have one with prebiotics. They have ones with iron supplements added in. They also have the best calcium chews on the face of the planet. Also some dark chocolate, hopefully coming in January, fingers crossed. But we love them. They make sure that our blood levels are doing well. They make sure that we are metabolically well as bariatric patients after surgery. And they are a wonderful partner with us as BariNation as we learn and grow together.
Thank you, Ms. Nat. ProCare Health is the official vitamin of BariNation. We all are faithful to it, and we welcome you to discover this amazing company as well. If you are new to ProCare Health, you can request a sample of free vitamins. So before you commit to a bottle, they'll send it to you. They're amazing. We have a discount code. We're happy to connect you with them after the webinar is over. Okay, my friends, we've done the disclaimer. Check. Let's move on to some quick introductions. I will just do our BariNation one. I think you maybe gotten to know us a little bit, but Jason, Natalie, and I are all bariatric patients in various stages. And we joined forces to create the support that we could not find after our own bariatric procedures. So we are a podcast, we're a membership community, we're an educational resource. We are support on social media. We are all things bariatric support. We really believe in supporting our community with humor, humility, and honesty. Dr. Weiner.
Unmute myself. So yeah, my name's Matt Weiner. I've already kind of given a little introduction about our practice. We're based in Tucson, Arizona. I am a bariatric surgeon. I've been in practice for 15 years now. I do a lot of gastric bypass and sleeve procedures. We also have a non-surgical program. Claire Pauly's here, and she heads up our non-surgical weight loss program. And she's really who I turn to for information about the medication. She's more current and up to date on any of that than I'll ever be. I did my residency at New York University Hospital and practiced in Detroit for about 11 years, and then moved to Tucson, Arizona 4 years ago.
Awesome. We are so thankful to have you in our corner, so to speak, Dr. Weiner.
Thank you. Good to be here.
Miss Claire Pauly.
Hi, everybody. I'm Claire. I'm the physician assistant in charge of non-surgical weight management at Town of Cure, like Dr. Weiner said. I'm really, really passionate about bringing evidence-based care to the disease of obesity. I think so often that is not the case. And I think at our clinic, we try to do a really good job of staying up to date with the evidence and really moving the treatment of this chronic disease forward. I've been in the chronic disease management space for the past 4+ years, and I've been at Pound of Cure for the past year.
I thought I could unmute myself by hitting my space bar. That did not work. I was going to say you're an absolute gem, Claire. We've had a lot of fun putting this panel together because we were just saying how very much aligned we are. And the next expert to introduce herself is a BariNation expert, an amazing member of our bariatric community, and a very close friend of ours, Dr. Whitney Adams.
Hi, everyone. I am Dr. Whitney Adams. I am a nurse. I am also a bariatric patient. I had gastric bypass in March of 2021, and I am extremely passionate about breaking the stigma around bariatric treatment and obesity, and then advocating for our community, as well as making sure that we have evidence-based resources available to us to use, and making sure that we're using the evidence to guide our treatment and when we're advocating for ourselves. So I'm excited to be a part of this panel as well.
We absolutely love and adore you for all of those reasons. If you do not follow Miss Whitney on Instagram, we all highly recommend you do. She loves sharing these studies that help us make these evidence-based decisions. So thank you for all that you do, Whitney. All right, my friends, let's dive in. Here are the objectives for our webinar today. So we're hoping that by the time you leave, we will all have a fresh understanding of obesity. We will learn to look at and talk about obesity through the lens of metabolic wellness. We will understand these new treatment options, specifically the GLP-1 medications that are now available. And we will understand the power of community. So if you guys are ready to dive right in, I say let's do it. And before I hand it over to you, Dr. Weiner, we have a quick question too that we would like to ask people about their belief around obesity. So that should be launching now. Friends, if you wouldn't mind, just take a quick second and let us know, what do you believe is causing your obesity? What is the cause of your obesity? And just pick the one that you think is most aligned to your beliefs. Oh, awesome. Seeing a lot of results coming in.
So interesting to see it come through live.
Right? Isn't it? I mean, we've all, yeah, Jesse, right? All of the above. It's hard to pick just one. Yeah. Yes. All right, guys, just about 10 more seconds and we'll go ahead and close it. I know for all of us, right, most of us, we've struggled with obesity our entire lives. And I think we go between all of these different causes. It's hard to pick just one, but that's how we grow. All right, I'm going to share the results. Fascinating. 18% of us believe it is related to our food choices. 4% are movement, stress and lack of sleep, 4%. 54% of us believe that it's genetically just a part of who we are. No one selected medications. 20% of us believe that we're missing motivation or willpower. Fascinating. Dr. Weiner, take it over, my friend.
Yeah, I think that is fascinating. I think in my mind, the one that I think probably the one that contributes to the least on that is the motivation and willpower. I think that, and I also am quite certain that of the 50 people who answered this poll, I would bet at least 5, if not 10 of them have gained weight as a result of medications and don't even know it. And so I think what I really do when I work with patients, and this is in general how our practice is set up and how we construct all of our treatment algorithms, is we look at obesity as a chronic disease. And you know, the problem that we've had with obesity is it's really kind of fallen into and become almost like a social disease, as opposed to a medical disease. And when you look at the science and understand why people gain weight, what strategies are effective for losing weight, you start to see that obesity is incredibly similar to a lot of other chronic diseases. Let's talk about hypertension, high blood pressure. Your blood pressure goes up, it's too high. What does that mean? That means that, you know, our blood pressure changes all the time. And if I stand up, my blood pressure will drop, but then my heart will kick in and start to squeeze a little harder and maybe beat a little faster for a few minutes. The blood vessels will squeeze down to try to bring the pressure back up. We call this process homeostasis, and it really dictates everything about how a human body works. And so what hypertension is when we're squeezing down too hard, and maybe our heart's beating a little harder than it needs to, and our body has dysregulated our normal systolic blood pressure. Instead of say 110 or 120, it's regulating it at 150. So if your blood pressure goes from 150 to 140, your vessels squeeze down, your heart kicks in, and it's regulating that number at 150 instead of 120. And that is a disease because elevated blood pressure puts you at high risk for stroke. It puts you at high risk for heart disease, and it can cause aneurysms and dissections and all kinds of other medical problems that will shorten our life and decrease our health. And so we have to look at obesity as the same thing. It is a deviation of our body's set point. Our brain works to regulate our metabolism, regulate our hunger, and keep our weight at that certain amount. That's why when you restrict your calorie intake, you go on a 600 calorie a day protein shake only diet, or you just count calories in MyFitPal and count to 1,200 calories, you lose weight at first, but then you start to get hungry. And you tell yourself all kinds of stories. Hey, I'm not really that hungry. It's just mind over matter. I can control this. But you start obsessing over food. You're watching the Food Network all the time where you normally don't. You're starting to think about it. You're maybe, looking at restaurants, and your mind starts to constantly wander toward food. And also you lose some weight at first, but then your metabolism slows down. And so when your weight drops below your set point, your metabolism slows down and your hunger increases. Your body's trying to take you back to that set point. So if you're going to treat obesity, if we're going to help people drive sustainable, long-term weight loss, not short-term lose weight in 3 weeks kind of stuff, but I lost weight years ago and I'm still at that weight, we have to lower your set point. You can go to the next slide, April. So before we talk about how to lower your set point, let's talk about why it goes up in the first place. And this really gets to the poll question that we asked. So genetics accounts for a huge percentage of obesity. And I was really happy to see that most people recognize that. And the truth is if you are overweight, your genetics is very often a major contributor. And they've done crazy studies with twins who were identical twins separated at birth. They touch base with them, 2 or 3 decades later as adults, and they often will weigh within a few pounds of each other. If one's 50 pounds overweight, the other's most likely overweight. Even if one grew up in a household where they were strict vegans and, didn't offer a lot of processed foods, and the other one grew up in kind of a fast food type house, we find that the house that you grow up in, the food environment, doesn't affect your body weight nearly the same way that your genetics do. There's a ton of genes that we already know about, and a lot more, I think, that we don't know about. But obesity is also an environmental disease. And our world is really targeted at getting us to eat and getting us to eat processed foods. If you walk around, really pay attention to the food that's in front of you, you will find that most of it is highly palatable, highly processed, heavily refined. And that's what's in front of us. And you really have to kind of go past your first 3 or 4 options to find that healthier food. And so we eat a very calorie dense diet because that's what's around us, when instead we should be eating kind of what I wrote about in my first book, which is a produce heavy diet, a plant-based diet, a nutrient dense diet. And so our nutrition definitely does impact our weight, but not in the what you eat last week, but what are you eating on a daily basis over years, if not decades. Our sedentary environments also, how many people have a job where they just sit on their butt all day long? It's incredibly common. And even us, Claire gets at least got a standing desk to her credit that she uses too. And so, I think a lot of us have this very sedentary environment. But I think even more important than just a general, lack of movement, what I see causing a tremendous amount of weight gain is injury. And I hear this story every single clinic day. I hear this story. I was doing good. I was 20, 30 pounds overweight, but I was managing it and I could kind of control it. And then I was in a car accident, and then I threw out my back, and then I broke my foot, and then I was laid up for months, and I gained 40 pounds during that time period. And I talk a lot about that when people talk about exercise, because you know what is probably one of the biggest causes of injury? Exercise. And so it's so important when you exercise to minimize your risk of injury. Disrupted sleep, whether that's from sleep apnea, which kind of becomes this spiral where you gain weight, that you develop sleep apnea, you sleep worse, which causes more weight gain. People who work the night shift causes a ton of weight gain. And it's not just that, when you work the night shift, there's a lot of processed foods around and you eat late at night. It's that disruption in our sleep-wake cycle. A high stress environment, just chronic cortisol relief. Cortisol is basically steroids, prednisone. Everybody knows prednisone causes weight gain. So untreated stress and depression, massive causes of weight gain. And I think the one thing, and nobody answered this, but I see it almost every day, is medications. And we see it for mental health conditions. Insulin, a few other diabetes medicines cause weight gain. Blood pressure and heart rate control beta blockers can a little bit. I don't think that's as much of an issue. Medications for nerve pain like gabapentin or Lyrica cause some weight gain. Without question, though, the biggest one that I see is for mental health conditions. And a lot of it's the second line antidepressants. So the SSRIs like Zoloft, Paxil, those types of meds, those can cause a little bit of weight gain. But it's the Abilify, and then now we're seeing people using some of the schizophrenic medications like risperidone for management of bipolar disease or depression, and those things cause a crazy amount of weight gain. Also, Depo-Provera, the long-acting birth control causes tons of weight gain. So I encourage all of my patients, if you get put on a medication, Google it. It's super easy. Google knows, does Lyrica cause weight gain? And you'll get it in the little paragraph form. You don't even have to read the article. Next slide, April.
Yeah. And I hope what we're all really embracing is that obesity is not just what we eat. It's a small portion of it. There's so many factors that go into this disease of obesity. And if we're internalizing that, thinking there's something wrong with us, it could really keep us from accessing the treatment that we need to treat this disease.
I mean, amen, April. I think you just really nailed it with that this obesity is a complicated medical disease, and it needs to be treated as a complicated medical disease. And it's not a matter of developing more willpower. Willpower will not prevent you from gaining weight if you started on Abilify. It won't. Mm-hmm. There's no amount of willpower that will allow that to happen. And so we have to start thinking about this in a meaningful, thoughtful, clinically accurate way if we're going to make progress. And we have to stop blaming ourselves and looking at this as our own shortcomings. So this slide also, I think, encompasses really the fundamentals of our practice. So we think there are 4 ways that you can lose weight in a durable fashion. And your treatment, when you're looking at what you can do to help someone lose weight, we look at all 4 of the treatments. Now, not all 4 will be appropriate for everyone, but all 4 of them are good options, and some may be right for you, some may not be. And we have to look and recognize obesity is a difficult disease to treat. And, you do not bring a knife to a gunfight. And so if we're limiting our treatment options, I think we're setting ourselves up for potential failure. So bariatric surgery is without question the single most effective set point lowering treatment that we can offer. Sleeve gastrectomy, gastric bypass, SATI procedure, duodenal switch. There's good things and bad things about each of these procedures, but they are extremely powerful set point lowering treatments. Weight loss medications, and that's what we're going to spend a lot of time talking about today, and I'll let Claire really go into the details on that. the new class of GLP-1 weight loss medications. I really refer to these as second generation weight loss medications. First generation would be phentermine, phendimetrazine, Contrave, metformin. These medications are sometimes helpful, but certainly they're nothing compared to these second generation class of medications. And they're extremely powerful. They work very, very similarly to bariatric surgery. And I think they're an incredible adjunct. In my mind, they're the biggest thing to happen to obesity since the advent of bariatric surgery, which was about 40 or 50 years ago. Nutrient-dense whole food eating. We focus on nutrition quality, not nutrition quantity. I talked about how calorie restriction sets off this increased hunger drive and slowed metabolic rate, and we want to minimize that. So we don't necessarily want to deprive ourselves of calories. We want to maximize the nutrients. And when you eat a lot of nutrients, it also helps restore a normal hunger signal and what we call the ileal brake, which is that satiety when you're like, I feel full. And then finally, movement, really resistance training, because what it comes down to, I think, with exercise is not burning calories, but more about building muscle and using your muscle regularly and having that muscle be very metabolically active. Muscle increases your body's sensitivity to insulin, and the more muscle you build and use, it helps to bring that set point down.
Dr. Weiner, we did have a question come through. They asked, what if the new set point is not low enough? Is this where the adjunct treatment comes in?
Absolutely. And that's, when I work with surgical patients, there's a calculator. I actually have a calculator on my website. There's a calculator out of Michigan. The MBSC, the Michigan Bariatric Surgery Collaborative, has a really good calculator where you can plug in my height, your weight, your age, some basic demographics, and it'll calculate the amount of weight you'll lose. And I will tell you, most of the time when I show this to patients, they say, oh, that's great, but how do I lose more? Well, you lose more by adding in the nutrition component and really dialing in the Pound to Cure program, by exercising vigorously, building muscle using it, and by adding medications. And it's these adjunct treatments, just like we treat cancer with chemo and radiation. And there's a big push to use nutrition to treat cancer, and even exercise reduces the risk of recurrence of cancer. We have to look at the treatment of obesity and use every item we have at our disposal if we're going to get that set point down as low as we possibly can.
I feel like I'm one of the bobbleheads. Yes, yes, yes. Right. But when we understand obesity and when we understand what is within our control and what we can do, we're empowered as patients to make much different decisions about how we're going to go about treating our disease, which is what this is all about.
Absolutely.
Wonderful. We're going to speak very briefly. We're just going to acknowledge, because we know that we're all patients here, right? There is a stigma against bariatric surgery. And there's also a stigma within our own community about weight loss medication, using weight loss medication either as a primary or a secondary adjunct treatment for our disease of obesity. Nat and Jason are going to speak very quickly on just what this has kind of meant in their own lives, because we just really want to acknowledge it. So Jason, we'd love you to talk about how the stigma of bariatric surgery really kept you from pursuing it for quite some time.
Yeah, for a very long time, like I really started contemplating having surgery about 5 years before I actually had it. My weight was bad, my health was bad, wasn't getting any better. There wasn't anything I could do. I had tried every fad diet you could imagine, Herbalife all the way down to you name whatever it was, I've tried it all. Wasn't really doing anything for me. I'd lose a little bit. I always found it, like hide and seek champ of all the years that I tried it. And honestly, it was legit, like all myself saying it to myself, like it's the easy way out. What happens if I don't make it? What happens if I fail? All the things that you tell yourself, I can just do it on my own. I don't need it. And as a man, especially myself, is harder for me to admit that I need the help, because it's just something I grew up with. It's just, rub some dirt on it, walk it off. It's fine. Don't worry about it. And that was just something that I, had to process as I was going through it. And it wasn't really until, it really kept me from having what I needed to have done for a very long time. But I look back on it now and I think that had I had it earlier, I might not have been ready for it. The success may not have been. So I, take it all, kind of find the silver lining in the whole situation, because I really had to come to grips with it when my doctor had a serious talk with me and let me know that I was actively dying at the age of 44. And I had kids and grandkids, and that was not acceptable to me. So I knew at that point there was nothing that anybody else could tell me that would deter me from doing what I am.
Yep. Well, and I know just in personal conversations that we've had, right? I think all of us, we fight back against the stigma and we don't want to believe it's true, but then we reach a point in our life where we're out of options. We have literally tried everything and there's nothing else to be done. And that's the point where we kind of become a little bit stronger than the stigma. But that takes a lot of time. It takes community, it takes conversations, it takes a lot. Ms. Nat, why did you continue to pursue your bariatric options after your first 2 bariatric procedures failed?
That's a great question. I think after those 2 first surgeries, I knew that it worked, right? Like I knew that I could get down to a healthier weight. I knew that my blood work could look good again. I knew that I could live a happy and healthy life. It was just an unfortunate circumstance that those surgeries did not work. They both medically failed and caused me some pretty severe complications. So I took a calculated risk in knowing that bariatric surgery, has changed immensely since 2009, and B, that I know that it works. There are so many more studies, there are so many more backed surgeons that perform these, such as Dr. Weiner and my surgeon. So I really just took a calculated risk, knowing that this was something that I needed to do in order to live a long, healthy life, because I couldn't do that at 400 pounds.
Yep. Well, and so appreciate, right, your thinking around that. We just launched a poll. We would love to know, what is your main motivator at this very moment for losing weight? Why do you want to lose weight? Right. And it's important to know that these whys can change. So if you're post-op and you're maybe struggling with finding that happy, healthy weight or regain, what's really motivating you? And if you're pre-op, what is motivating you? Let's take just a few seconds to address that. And we just want to make it clear, we are aware of this double standard when it comes to the chronic disease of obesity. Any other chronic disease can have treatment almost instantly, or it's over the counter, it's accessible. Obesity is the only chronic disease that the insurance or the medical establishment will make us wait months and months and months to access that. And the whole reason that we're doing what we're doing is to help end that, to lower those standards and to get more people the treatment that they need. All right, let's close out this poll. Oh, I keep seeing them coming in. 5, 4, 3, 2, 1. All right, let's share these results. We want to lose weight for all kinds of right, amazing reasons. We want to be healthy. We want to stop taking medications. Our mobility is limited, right? We're worried about our mortality and right, leaving this earth sooner than maybe we should. We don't like the way that we look. We want to feel or physically different, right? And we just want to weigh a certain weight. Wonderful. Thank you, friends. We are going to hand the mic over to Miss Claire Polly. She's going to share a little bit about metabolic wellness.
Hi, everybody. April, you can advance the slide for me. So what is metabolic wellness? So the way I define metabolic wellness is really leading a life free from chronic disease. And this includes multiple chronic diseases beyond the disease of obesity, right? So we're talking about leading a life free from type 2 diabetes, high blood pressure, high cholesterol, fatty liver disease, sleep apnea, chronic kidney disease. And it turns out that, when most patients come to me and I ask, why did you come to my clinic today? Usually it's not just that they want to get down to a number on the scale. It's really that, hey, I really want to get off of my medications for blood pressure, for cholesterol. I really want to live a long, healthy, happy life. And so really focusing on that as the goal of treatment rather than some arbitrary number on the scale is really, really important as we're looking at what treatment options might be better than others. You can advance the slide.
And I'll just say, right, like we believe that metabolic wellness is the end goal here. Yes, we might have a weight or a size in mind, but if we are metabolically well, we are living the dream, right? It helps us step away from the scale. It helps us step away from this idea or obsessing about like we should look a certain way or we should weigh a certain thing. If our goal is really longevity and to really get our life back, metabolic wellness is the goal.
Great. So just to briefly touch on metabolic syndrome. So, a lot of people will come to me and they'll say, well, I don't really have, any of these disease processes. And so a good way, one way, and this is not the only way, to look for kind of markers of increased risk of developing these chronic diseases down the road is to look at some of these different parameters. So looking at both triglycerides as well as cholesterol, blood pressure, waist circumference, blood sugar. So not necessarily having the disease process yet, but having those early stages. So I am a big proponent, in the United States, the way we treat disease is you have a disease and that's when you get treatment. And as you're sneaking up closer and closer to that disease, no, we don't get to treat you yet. And that's a really terrible way to treat disease, because guess what? It's a lot harder to treat type 2 diabetes with a blood sugar through the roof than it is to say, hey, we're creeping in that direction. Let's get this under control now. Right. So that's why I love this field of medicine, because it turns out that as we start to treat the disease of obesity, all of these other metabolic disease processes improve along with that. So again, yes, you see here waist circumference. That is certainly an important piece of the picture of metabolic disease. Weight is certainly an important picture, but it is not the only piece of the picture. And it's really important to kind of move beyond that. And as we're setting goals, set goals in the metabolic realm, not the weight realm necessarily. Speaking of which, so really trying to rethink our, look at you, April, you just got it. So really trying to rethink our goals. I have so many people who come to me and it is 150 pounds. And if I don't get 150 pounds, then I'm not happy. And if we're at 160 pounds and our blood sugar looks awesome, we've gotten off of all of our blood pressure medications, let's celebrate that, right? Let's stop. I think society makes us think that we have to get to some certain arbitrary number on the scale that really I push back against a lot with my patients, that, hey, let's have some different goals.
Yep. And in the BariNation world, we talk often about our happy, healthy weight, right? That might not be a weight that it's not my high school weight, but it's a weight that allows me to be metabolically well. And it can find some time to really understand and get to that level. But so many other things take precedent in my personal health journey than just the number on the scale.
Absolutely. And just remembering that body mass index is a very imperfect measurement, right? So a lot of people want to get their body mass index out of whatever range. And guess what? That's a really good, fairly good measure for population health. It's a really crappy measure for a person's individual health. So keeping that in mind as well.
And Claire, before we move on, can you just, to really drive it home, because I know that metabolic wellness is it can be a kind of an ambiguous term for some who have not heard it. Can we just drive home, like, what does it mean to be metabolically well, or are we going to touch on that later?
Yes. So again, kind of my definition that I think of is leading a life free from chronic disease, right? So, and the ones that we talked about, diabetes, high blood pressure, high cholesterol, that allows us to increase our chances of having a long health span, meaning a long period of our life that is lived in health.
Great, thank you.
Yeah, you bet. Okay, so going back to the big four that we've talked about earlier, so kind of the big four in terms of treating the disease of obesity are going to be bariatric surgery, of course, nutrition, movement, which we've touched on earlier, and then also medications. So surgery, nutrition, and movement are some tools, and they're probably the tools that your bariatric surgeon has talked to you about in the past. They're not the only tools to treat the disease of obesity. And if you have surgery, that does not mean that you are then not eligible for any other treatment option. Again, kind of going back to that chronic disease double standard, how come every other chronic disease, in fact, for high blood pressure, for example, when we treat high blood pressure, it is standard of care that if your blood pressure is to a certain level, it's recommended to start with 2 synergistic, meaning 2 medications that work well together and kind of enhance each other's effects rather than 1, right? So we really have to let go of this idea that surgery is your last stop, and there you have before surgery and you have life after surgery, and it's all rainbows and butterflies after that. Most people have some amount of struggle with a small amount of weight regain after surgery, and some people struggle with a significant amount of weight regain after surgery, and or don't quite meet their goals after surgery and need that adjunct treatment option. Okay, so the medications. So the class of medications that we are most excited about and talking about today are these newer agents called these GLP-1 receptor agonists. You do not have to remember this name. It stands for glucagon-like peptide 1 receptor agonist. That means nothing to anybody. So how do these medications work? So these medications really mimic gut hormones that we already create, that go up to our brain and basically say, hey, I feel full, I feel satisfied, I'm good down here. They go to our stomach and they slow gastric emptying, so we get fuller quicker and stay fuller for longer. And then they also go over to that reward center of the brain and they say, hey, that emotional eating bout, that boredom eating bout that I was gonna do, I'm just not that interested in that anymore. So this may sound a little bit familiar for a lot of people after bariatric surgery. It's kind of a similar effect. They say, hey, I kind of crave the right stuff. I get full a lot sooner. I'm not as interested in food. And the food I am interested in is healthier. Well, it turns out after bariatric surgery, one of the major routes by which bariatric surgery works is through basically a shift in hormonal regulation. Right? So it's really hormonal regulation of that set point, lowering that set point, making your body think, hey, my starting weight wasn't up here. My starting weight was down here. So I don't have to pull so hard for you to regain that weight, like Dr. Weiner was talking about earlier, right? So that's wonderful. These medications are incredibly effective for long-term weight loss. For people without diabetes, the older generation of the GLP-1 medications is going to result in about a 10% total body weight reduction for most people. The newer agents are resulting in about 20% total body weight reduction for most people. So very, very, very significant, way more significant than any of the older generations of medications that we saw. These also are going to improve overall metabolic wellness. So again, as we're looking at, let's say you've lost weight after bariatric surgery, you're starting to regain weight. As you're looking at, well, is it time that I start a medication to help with this weight regain? We really want to look at, well, is your blood sugar creeping up? Is your blood pressure creeping up, right? Are these markers of metabolic wellness getting a little bit worse? And the good news is GLP-1 medications, unlike some of the older classes of these medications, does a really good job of improving metabolic wellness. So these are originally anti-diabetes medications. So these are, and they're the most effective anti-diabetes medications on the market. But not only do they help improve diabetes, they've been shown to help improve prediabetes. So really reverse any of that prediabetes, insulin resistance, polycystic ovarian syndrome, those sorts of insulin resistance pictures that might be going on. They help to reduce fatty liver disease. In fact, they're being studied and hoping for possible future approval for that indication. They help with all sorts of other markers of metabolic health. In people with type 2 diabetes, they actually reduce long-term risk of what are called major adverse cardiac events, meaning heart attack, stroke. Some of these medications are reducing that risk by a quarter, by 25% in people with diabetes. To be determined if a similar improvement in long-term cardiac health is shown with people without diabetes, but my inclination is I know it's not hurt, and I would be, surprised if it wasn't helping.
Wow. what makes this so powerful is that instead of thinking about these weight loss medications as just focusing on our weight, it's actually addressing the underlying causes to the regain, right? Or to just that set point going up again. So these are more than just weight loss. This is overall holistic metabolic wellness medication.
Absolutely. Absolutely. And, you know, we know that years out from bariatric surgery, weight regain starts to occur. Part of that is probably because some of these metabolic shifts, some of these hormonal shifts that happened after surgery, that becomes a little bit less robust over time. And so this is kind of like a tune-up for your surgery, right? This works in this synergistic way to say, okay, this surgery, we're going to make this a little more effective again. So that you can be successful in the nutrition and lifestyle changes that you're trying so hard to make long term.
Yes. There's two actually great questions in the little Q&A box, and I'm just going to hit the answer live button. I'm not sure if it's going to bring them up on screen, but Amanda asked, at what point after weight loss surgery are GLP-1s considered appropriate? Is there like a time marker for them?
Great question. So that's actually been debated in our clinic a little bit. The short answer is we don't know what the optimal time is to restart or to start GLP-1 medications after bariatric surgery. I know some people are starting them, you know, at the 6 to 9 month mark. Other clinics are choosing to wait a little bit longer. You know, Dr. Weiner, do you want to speak on that a little bit?
Yeah, well, first of all, I think the question is probably not going to be relevant within about a year or two, because we're starting so many people on them before surgery. And so I think that's going to be something that's an even another complexity to it. I don't know if there is a right answer. We'll keep people on them from the beginning. I think as soon as you look at your weight loss curve and maybe say, hey, this is not where it should be, which we can see that at 2 months out from surgery. So I wouldn't have qualms about starting someone who is doing well, meeting fluid and protein goals at 2 months out from surgery on one of these medications, if I thought that their weight was falling behind. That's a little aggressive, and I think I am probably more aggressive than most bariatric surgeons, but I think what Claire said, 6 to 9 months, is probably a more standard answer.
Awesome. And I see there's another question in the Q&A box, and I don't know if you've specifically addressed this yet, Claire, but you said stay tuned. It's, do we know anything about the rebound effect from GLP-1?
Yes, I would love to talk about this.
Yes.
Okay. So here is another double standard situation, right? So you have high blood pressure and your doctor puts you on a blood pressure medication. I have not met a person who thinks that they're going to go on a blood pressure medication for 3 months and their doctor says, great, let's take this for 3 months and then we're going to stop the blood pressure medication and you're cured. It's done, right? I've never met a person who believes that. So how come a lot of people say, well, if we're taking these weight loss medications and we stop them and we regain the weight, that means these weight loss medications don't work. And I say that's not how chronic disease treatment works, right? So any option that we choose for long-term management of weight, right, whether it's the durable effect of surgery or nutrition changes, exercise changes, sleep changes, stress changes, medication, any of those we have to stick to long-term in order to maintain that lower set point. If we stop doing any one of those things, yeah, our set point will go back up. Now, in terms of a rebound effect of our set point going up higher than the weight we were at before, like let's say for some reason, oh my goodness, insurance stopped covering this, which can be a problem for some people, and we have to stop the medication altogether. You know, the studies that have been done on this, and there are few, but the studies that have been done on this don't show a rebound above and beyond the weight we were at before. But we really, I think, have to shift our thinking in chronic disease treatment, specifically in obesity treatment, to understand that like every other chronic disease, yeah, we need long-term treatment. And that shouldn't mean to us that these medications don't work. The other thing I usually say to my patients is, okay, so I don't like medications any more than the next person, but I would way rather you be on one medication long-term that's going to keep weight down, keep blood sugar under control, keep you off of blood pressure medications, all of these things, then have you be on a separate medication for each of these chronic diseases, some of which might be causing weight gain rather than weight loss. Now we're in this polypharmacy situation where we have lots of medications that might be interacting. Let's, when we look at those two options, I'm going to stick to the one, right? And most of my patients look at me and they're like, yeah, I get that. That's what I would do too.
Yeah. Well, and I also saw in the Q&A, and I'll just let everybody know this. There was a question about like, how do I go about talking to my PCP about this? How do I have that conversation? We have a future webinar planned. It's actually going to be the third part of this webinar series where we're specifically going to talk about how we can have these conversations with our medical providers about these types of this new class of medication. So that is coming very soon for our community. Claire, before we kind of go on to that next slide, what are the names of these new class of medications? What do they go by?
Great question. So there are only two FDA approved for treating the disease of obesity. So those are Wegovy, which is currently on back order and hopefully at some point later this year will be available again in pharmacies, and then Saxenda, which is a little bit older of these medications. Then so it is perfectly legal and acceptable to use basically medications off label for the treatment of diseases. Providers do this all the time. So we use a lot, and a lot of providers use a lot of the medications approved for treating diabetes off label in the treatment of obesity. So those you might have heard of. The newest one on the market is Mounjaro. There's a lot of talk about Mounjaro lately, but also Ozempic, Rybelsus, Victoza, Trulicity. So those are some of the common ones that you may have heard of.
And I would just like,
there's one question in there, also a follow-up to talking about the metabolic set point change it or being on the long-term meds. Somebody was asking if you're on the meds and you adjust your habits and things to a little more aligned with what the meds are doing and you come off the meds, is it still going to be the rebound?
$1 million question. So everyone knows their token friend who's lost 100 pounds and kept it off long-term with diet and exercise alone. Do those people exist? Absolutely. I don't know what what the difference is with them genetically. I don't know what the difference is with them, environmentally, but the majority of people, right? 95+% of people who try to lose weight and keep it off long-term with nutrition and exercise alone are not successful. So again, is it possible? Sure. I'm never going to tell you that you can't accomplish something. And if that's the route you want to take, go for it. But using the right tool for the job, right? So if we have a significant amount to lose and keep off, amount of weight to lose and keep off, usually we need a more powerful tool for that job. The other thing to know is, oftentimes if we are trying to lower set point or, lower our weight with diet and exercise alone, with our body trying to pull us back up, oftentimes that becomes a fairly all-consuming process, right? We're dedicating a lot of our energy, time, life to maintaining a lower body weight. And so if it just becomes slightly easier to keep to those dietary changes because our set point is lowered hormonally, gosh, you have a lot more free time to be the cool person that you are and, go live a life. And so, yeah, it's possible, but it's not the only option and it shouldn't be stigmatized to choose a more effective option.
Well, I think more of the question was more along the lines of if they start out with the meds and then stop the meds, but continue like eating the lesser amount that the meds keep them to, will that maintain that set point without?
If they live in, so here's the problem. If they stop the meds, their set point starts to drift back up. That means all of those changes Dr. Weiner was talking about, increase in hunger, increase in food seeking behavior, decrease in metabolic rate, all of these things, decrease in, it's even been studied, we decrease our what's called non-exercise activity thermogenesis, meaning our moving and grooving naturally throughout the day. Even that, we become a little more sloth-like when, our body's trying to pull us back up towards where we were before. So all of these underlying biological changes, sure, if you actually, are able to maintain that, but the problem is that that isn't something that most people can maintain because there's such a powerful pull back up.
They did a really fascinating study about bariatric surgery that I think relates to this question. The initial thought about bariatric surgery was it works by restricting calorie intake. And so they took two groups of people. One were fresh post-op patients, and they measured, they said, okay, these people are eating 600, 800 calories a day, and this is what they're eating, just 3 shakes and maybe a little bit of applesauce. And they kind of created a post-bariatric surgery diet. And they said, it's not the surgery, it's just what they're eating. So we're going to take this group of non-surgical patients, and we're going to have them eat exactly the same things that the bariatric surgery patients eat. And we're going to show that the weight loss is the same. It was twice as much in the bariatric surgery patients because of what Claire was saying about the set point lowering, and the metabolism is not slowing down in response to calorie restriction. And I think with the meds, we're going to see the exact same thing.
Yeah, so the other pertinent study to this is with Wegovy, one of the 2 approved for treating obesity. So they started everybody out on Wegovy plus intensive lifestyle modification, right? So at 20 weeks, everyone was told to continue with their intensive lifestyle modification, and half were switched to placebo. So they still thought they were getting some sort of a medication. They didn't know that they had been taking off of a medication. So everyone losing weight up until the 20-week mark, great, they lose like this. As soon as that shift happens, the lines look like this. So these people regaining the weight, they still are trying incredibly hard to maintain that weight loss. But it's, set point is powerful. Our body does not want us to go outside of this tightly regulated range.
No. And we will make sure, you guys, to include some of these studies in any communication that we do after this webinar. So after we've concluded this, our plan is we're going to send you a link to this recording so you can watch it again. We have a fact sheet, we have frequently asked questions, and we will be sending these studies out to you as a tool that you can use to better understand the impacts that these medications can have. So the learning does not stop here, my friends. I know that we are 1 minute over time. If our panelists wouldn't mind giving us another 15 minutes, and we invite you all to stay on with us. This is being recorded if you need to pop off. There's one question that I would like to ask about this medication, and then we're going to move on to Dr. Whitney Adams, who's going to give us some amazing insight onto why she has chosen to onboard medication as a secondary treatment. Stephanie asked in the Q&A, what if you don't want to lose any more weight? Can you take these medications as a maintenance tool?
So usually if you start one of these medications, you are going to start losing weight, right? So if the question is, hey, I got down to my lowest weight after surgery, now I've regained weight, I just want to get back down to my, lowest weight. Sure. But if the question is, hey, I've reached my maintenance weight, what I usually recommend is, hey, let's watch that. Let's kind of see how you're doing. If we start to notice some weight regain, then let's, start discussing other treatment options, because we don't want to overshoot. And actually, really interestingly, some of these medications are becoming so effective that we're now talking, in this specialty space about, okay, how do we deal with people who are actually overshooting our goals? And obviously at that point we start pulling back on treatment, but we really don't want to go below a healthy body weight, because of course that's not healthy either. We always talk about, the above a healthy body weight, but below is not healthy either.
Wow. Okay. This is fascinating, friends. And I think I want to specifically call this out. We know that some of us have heard, right, in the community, this stigma that is now being attached to weight loss medications after bariatric surgery, and that people are just taking these medications to just lose the regain and are doing nothing else. The only way that these medications work is when they're being used as an adjunct treatment to the primary and to all of the other things that we have to do to maintain and keep that set point low, which includes whole food, unprocessed nutrition, right? It includes resistance movement, it includes community, right? It includes all of these other things that are necessary. Medication is just another treatment that we can onboard if we're having problems with maintaining that. Awesome. Wonderful. Continue to put your questions, my friends, in that Q&A box or in the chat. It is being saved, and we will make sure that we include as many as we possibly can in that frequently asked questions sheet that we're going to send out after the webinar. Very excited to hand this over to Dr. Whitney Adams.
Thank you. I appreciate it. Yeah, so I am excited to be sharing my story with you guys as a expert in doing things in healthcare, and then also now as a gastric bypass patient. So I don't know about how many of you who have had weight loss surgery, but you probably had the feeling that this was all that I needed. If I just get this, I would be done. I had that same mentality going into it, even though I knew it wasn't rational. I mean, honestly, I knew I had to do the nutrition and the movement, which is things that I was doing pre-weight loss surgery. In fact, if you drill back on my Instagram, you'll see I was doing garage gym workouts. That is what I'm known for, by the way. And long before I started the process for bariatric surgery. And so I thought that, well, this will be the one thing that I need. Quickly after surgery, I realized I needed to onboard a lot more therapy. I'd already done some pre-psychological evaluation work, but realized that I needed more of that. And then also needed to onboard more community support. So after I had bariatric surgery, the first 6 months were great. It was good. Everything was working like it should. I wasn't hungry. I wasn't having that surge of the hunger hormone. I was moving my body. I was drinking my fluids, meeting my protein goals. And I just felt like, okay, this is great. This is what I've been looking for the whole time. Then about 11 months out, I just was raging hungry all the time. Like it came back like a beast that I was so starving, I felt like. And so I was like, well, we're making some big life changes. So maybe that's what's going on. I met with my dietitian. We adjusted my macros. I continued to work out consistently 3 to 5 days a week. Lots of, mixture of mostly resistance movement. I love strength training. So I was doing that. I was going to my therapy sessions and my weight was not budging. And I just felt like I was not getting anywhere. So I made an appointment with my PA and I was like, hey, what's going on? I don't understand. I'm following all the rules. I'm the rule follower to a T. Why is this not working for me? And so she was like, you know what? Let's just try phentermine. So we did. So I was on phentermine for a couple months and I just did not feel well with that medication. It didn't add some of the side effects of the medication. But the reason we started on medication was because I was noticing that, like Claire said, my metabolic wellness was not going well. My A1C was creeping back up. I was seeing some of those things that I was having problems with before that I just was not wanting to go backwards. And so I wanted to continue to make progress. So I actually in June, I was like, I just am not feeling like I'm having a lot of effectiveness with this medication. And so I, being a nurse, started doing the research also, started looking at studies, started looking at what was out there, especially with these GLP-1s. There's a lot of buzz going on with it and I wanted to know more about it. My dad's on it for his diabetes and I just wanted to see what was going on. And so, started looking at it and I brought it up to my physician and I was like, hey, I'm seeing a lot of really good and interesting results. I know it's not specifically studied in weight loss patients at this time. I know they're continuing to look at that, but what do you think about switching to a GLP-1 medication? And so by taking this information, just like you're getting in this webinar, I learned how to advocate for myself to be able to ask for the medication and to ask for other options to continue to treat this disease of obesity. Knowing that, I think going into this, that medication may be a lifelong thing for me, and that is okay. I'd much rather be on a GLP-1 medication or as it adjusts to whatever comes in the future than to be on insulin like my father or dialysis later on or something like that. So I would like to go ahead and treat this chronic disease now and continue to be metabolically well. So I actually was prescribed, I was one of those ones that was prescribed Manjaro. So I started that about 8 weeks ago. This is my 9th week. I'll take my 9th shot tomorrow. And I have had significant, I had not changed. I'm about 20 months post-op. I am 20 months post-ops. I had not changed in my weight from month 11 to month 18, just had not moved, I mean, no matter what I did, no matter how much I went to a calorie deficit, started doing some unhealthy things where I was trying to do a real strict calorie deficit, was just not seeing that result. And so was like still having those problems. And so I started this medication, and one of the things that I immediately noticed was that craving piece. And Claire spoke about it a little bit. It's just where I lost that interest, where food wasn't consuming my thoughts all the time. because I'd gotten back to the point where I was tuning into the Food Network, or when my Southern Living magazine came with all the pies that I could make for Thanksgiving. It's very interesting, and I wanted to read all about it and think about how could I make this bariatric friendly or not, and just have a small amount. But it was just constantly something I thought about. When is my next snack? I became obsessive about my times. Okay, it's been 4 hours. Can I eat now? What can I eat? And then the grazing and the snacking and things like that. Well, now it's kind of going back to how I felt in those first 3 months post-op, where I'm fueling my body and my food is fueling me, as opposed to I need it as far as a craving. And so that has been a big change that I've noticed with these medications. After the last 8 weeks, I've lost a total of 18 pounds. So finally started seeing that scale move again. But one of the really awesome things is I actually have PCOS, one of my other pre-existing conditions. And so I've had a lot of reduction in symptoms with that, which is also something that's studied with these medications. And so having a much better cycle, much more manageable cycle for me, and much more regular, something that even with losing 130 pounds, I had not had. So it has been another big area for me that's been really helpful. So for me, I think the biggest thing is, as a bariatric patient, just becoming aware that sometimes we're going to have to onboard these adjunct treatments, and it's okay. It doesn't make you a failure. We don't need to go into what one of my therapists calls it stinking thinking. We don't need to go into the stinking thinking and thinking that we failed as a bariatric patient. I am the one that is always trying to follow the rules, and even following the rules, I was not having the success that I wanted to have, and I was still not metabolically well. And so I think we need to get that whole stigma that we have been fighting since we've had bariatric surgery around medications out of our whole mindset, and understanding that this is something that we need to treat our chronic disease. And we have a chronic disease, and it is going to require lifelong treatment. So we are always going to have to eat healthy. We are always going to have to move our body. We are always, our tool is always going to work for us, but we are also going to have to do other things to make it work to the best of its ability. So that is what I really wanted to talk about, as how you can advocate for yourself. So this information that you're getting in this webinar, and turning to very credible sources, not Google, don't be Googling what you need to do, but getting credible information from your physician's office, from places like BariNation, from Pound of Cure, and getting these real studies and looking at what it can mean to you, not from some TikTok star, but how you can actually use these medications to your advantage and advocate for them.
I was trying to find my unmute button. It was maybe 2 months ago, or 3 months ago, you gave me a word that I did not have before, and it has absolutely changed my life as a patient, and that was adjunct treatment. Right? We went into surgery thinking that it would be the only thing that we would need, and that is absolutely not true. When I challenge all of us tonight to really take a quiet moment and reflect on all of the little treatment things that we have had along the way, all of the things that we have done to attempt to get to this low weight. Those are all treatments. Mm-hmm. And we need to really start thinking and addressing them as exactly that, because like every other chronic disease, the one primary treatment is not going to be enough. It is going to require that adjunct treatment. And you gave me that word, and it has just been such a powerful thing that I think everyone now can use in their toolbox. So thank you so very much for that.
Yeah, absolutely.
Ms. Witt will be joining us at our other webinars that are coming up to talk more about, just the stigma behind it, how we can go about talking about these medications and these other treatment options in our own lives, and then how we can talk about medications with our primary care providers and with our weight loss surgeons. Thank you, friend, for being so open and honest about your journey.
Absolutely. Sorry, that was the condensed version.
Okay, but if you know me by now, hi, hello, welcome. I plan far too much, and then this is just my life. I think I will just very briefly touch on this. If you are feeling that your surgeon did not maybe equip you with all of the tools to find and maintain that happy, healthy weight, you are not alone. If you went into surgery, if you were prepared for surgery thinking that it would be the only thing, It's not. Struggling after surgery is the most common, I think, effect that all of us patients will experience. And regain is very common. It is very normal. To find and maintain our happy, healthy weight, we have to dedicate our lives to living what we call the 3 pillars in BariNation: movement, mindset, and metabolic wellness. This is a constant tool, constant treatments that we need to use to keep our set point low. And what we believe is that becoming and seeking out a member of a community is really that 4th pillar of bariatric life. It is the piece that for most patients is missing, and it can be one of the most powerful treatment adjunct treatments that we can use. So what we always say in BariNation is there's no such thing as a bad bariatric patient. We are either making decisions that are in bariatric compliance or out of bariatric compliance. Our humanity is not tied to our disease. We are not our disease. We are learning to live with this disease. So if you are struggling, if you are finding it difficult, if you're feeling alone, or you're feeling isolated, or you just don't know where to turn, finding a group of like-minded people who can help you process through those emotions and those feelings, right, in conjunction with the support of the experts, can be maybe the thing that you are also looking for. This journey was not designed to be done alone. It was designed with peers and with experts. So if you're feeling that way, we encourage you to reach out and seek that community. So to wrap this up, my friends, we just want to give you a direction. Where do I start? It's probably what we're all wondering. We have 4 things that we would like to encourage you to do. Speak with your primary care provider or your bariatric surgeon, right? Your doctor must be your primary point of contact if you are considering onboarding medications as an adjunct treatment. This is designed to just inform you, to pass along some education, connect you with some resources. We want to arm you with the tools that you can then take to your surgical provider. We would encourage you to do some self-reflection, right? Are you constantly working in those pillars? Are you learning about metabolic set point, right? Are you focusing on nutrition? Are you focusing on movement? Are you focusing on mindset? Have you connected with the community? Are there areas that you could improve in? And if you can, that's a really great place to start with that self-inventory. But we want to make sure that we give you permission to not be perfect, to onboard more adjunct treatment. Find a balance between the things that you could improve upon and reaching out to your medical team to see if there are other treatments that you can onboard. Miss Whitney's famous for saying this, right? It is all about progress, not perfection. We encourage you to seek out a bariatric community where you feel safe and welcomed. You can ask your surgeons for recommendations. We're going to share our 2 communities that we absolutely love and adore, but there are a lot of options out there. We would just encourage you to look for a community that is equal voice expert and equal voice kind of peer-to-peer support, right? Facebook can be a really scary place. So let's look for options that really provide both, and then seek out factual information from reliable sources. We're going to be passing along this more information to you in the weeks coming, but just knowing that those reliable sources is what we are striving for. If community is something that you're looking for, we invite you to join the BariNation membership community, my friends. We literally have hundreds of live support events every single month. We have a robust on-demand video library. We have experts that we work with. It's a pretty magical place. And because you're joining us live tonight, we'd like to offer you an entire month to see if our support is right for you. We know that our support might not be the perfect place for you. That's okay. We want you to find a place where you feel that you belong, where you feel like you are a part of it. Dr. Weiner also has an amazing community. We know because we're in it too. We spend a lot of time with their experts. We spend a lot of time learning from him. So there are plenty of opportunities for you out there. Our goal is that you find the place where you know that you belong. Dr. Weiner and Claire have offered to join members of the BariNation community for a very special Q&A. This is just an opportunity for you to come and ask your questions in maybe a little bit of a more private environment. It's going to be on December 7th in the BariNation membership community at 5:30 p.m. Pacific time. So if you are interested in continuing this conversation, if you're interested in connecting with Dr. Weiner and Claire, this is where you can do it, and we invite you to join. And if you do take advantage of that very special month-long free trial, you'll still be in that free trial, seeing if our community is right for you when this event happens. Oh my gosh, I think we did it. That was a lot. Miss Witt, it was my intention to put your Instagram handle on here, so will you please include it in the chat? I did not mean to do that, and I apologize.
You're good. I included it in the chat.
Oh, thank you. So you can follow BariNation on Instagram. We are at Bari.nation. The dot is very important, as we have recently found out. And you can follow Dr. Matthew Weiner at his handle, Dr. Matthew Weiner. And we will also send out this presentation as a PDF, so you guys have all of this information as well. Last but not least, a huge thank you for joining us. This evening has been amazing. So much information was shared. Dr. Weiner, Claire, we know how valuable your time is, and we just cannot thank you enough for carving some out for our amazing community. Claire, is there anything you would like to leave our friends with?
I'm just really excited to be a part of this community, and really excited to be able to share hopefully some helpful information this evening, and looking forward to the Q&A. And thanks everybody for attending. Have a very happy Thanksgiving.
Thank you. Dr. Weiner, I'll give you the floor to wrap us up.
Yeah, I mean, I think, just building on what Claire said, I think we're really happy to be part of this community. As clinicians, we kind of focus on a one-to-one patient interaction, and when everybody gets together, there's so much power in groups. And I think I really applaud you, April, Jason, Whitney, Natalie, for what you've done putting together this community. It's so valuable, so important. So thank you for doing it.
It took us a while to really understand that we are experts in our patient experience, and we are allowed to seek out and create the support that we need. And when we partner with experts like you three, we can create the support that we need as patients. So just thank you so much for really believing in us and recognizing that patients are experts in their own experience. We very much appreciate that. All right, my friends, thank you for spending 21 extra minutes with us. This will be recorded, and you are going to get an email for just a post-webinar survey. It is anonymous. We just want to make sure that these are formatted in a way that you enjoy and that you got out of it. But real quickly in the chat, you guys, if you are leaving today with what you were hoping to get, I would love an emoji drop, just so we know that we hopefully hit some of those goals today. So thank you, friends. Oh, I love seeing that. Thank you so very much for joining us tonight. Give us a follow. We're excited to connect with you. If you send Dr. Weiner a DM, it is Dr. Weiner behind that. If you send BariNation a DM, we are the friendly faces behind it. If you send Natalie a DM or Whitney a DM, she's the one. So continue to reach out, and just thank you so very much for being so excited to advocate for your health. Have a great night, friends. See you soon. Bye.